Hey everyone, hello, good evening, and welcome to another Live with Dr. Dawn. I am your host, Dr. Dawn 𝘄𝗶𝘃𝗃𝗄𝗃. I'm a double board certified child, lesson, adult psychiatrist, also a sports psychiatrist, a two-time best-selling author, podcaster, producer, public speaker, media influencer. I'm the sole practitioner of ADHD Wellness Center in Houston, Texas. I'm also the founder and CEO of Mental Healthletics for elite athletes. And thank you so much for joining us this evening for another live segment. Hey, listen, go ahead. You know what I'm going to ask you to do. Go ahead and share this with everyone you know. Share this with your social media families. Hi, Katrina. Thanks so much for joining. Hello, Erica. Dr. Gooden, thanks so much for joining. And listen, go ahead and put your questions in the comment section. If we have time, we will definitely get to the questions because I have 9 doctors that are, in addition to myself here in the virtual space, 9 doctors who are here to address important topics related to their specialties. And I'm so blessed to have them on here in the virtual space with me today. So if there's any questions, go ahead and put them in. And if we don't get to them during the live segment, we'll definitely address them on the replay or after the live episode is done. All right. Hi, Anita. Thanks so much for joining. So we all know that the holidays are fast approaching. Thanksgiving, Christmas, New Year's, right? And with the holidays fast approaching, we also know that coronavirus is still definitely in the midst. And so we wanted to make sure that we came to you as board certified doctors to bring to you updates regarding our specific specialties, what we're seeing in the office, the practice, the questions that we're answering, the cases that we're seeing, many of the questions that come from our patients, or even our personal experiences in dealing with coronavirus. But we also want to prepare you for the upcoming holidays. We know that the holidays are a joyous time, a time for celebrations for many families. It's a time for social gatherings, potlucks, well wishes, spending time, right? We have the whole entire year, and then we look forward to this time of the year. Many families do. And so with that, we have to really consider social distancing. We have to consider hand washing. We have to consider masking up, being vigilant during this time because of coronavirus 19. And so this is what we're going to talk about and discuss this evening. And without further ado, we're going to get right on to it. All right. I have with me 9 other physicians or doctors, that are here with me. We have Dr. Steve, Dr. Zarina, Dr. Lakeisha, Dr. Donald, Dr. Nicole, Dr. Sam, Dr. Napoleon, Dr. Jared, and Dr. Alexia. Thank you so much, everybody, for joining me this evening. I'm going to start with Dr. Steve. We're going to go right across. And please, if you don't mind just introducing yourself.
Hey, good evening, everybody. My name is Dr. Stephen Noble. I'm a board certified cardiothoracic surgeon, meaning I specialize in the treatment of the #1 killers of Americans, heart disease and lung cancer. In addition to that, I am an associate producer for the upcoming documentary, Black Men in White Coats. Please check it out by Dr. 𝘄𝘄𝘄𝗃𝗄𝗃𝗃𝗄𝗃 on blackmenandwhitecoats.com. And I serve as Chief Medical Officer for 𝘄𝘄𝘄𝘄𝗃. 𝘄𝘄𝘄𝘄𝗃 is a startup company by Black men looking to change and decrease the healthcare disparities in Black people by empowering barbers and hairstylists to encourage their clients to seek healthcare. So we're trying to reimagine healthcare and revolutionize healthcare by bringing healthcare to haircare. Thank you for bringing me here, Dr. Don.
Thanks for being here, Dr. Steve. Dr. Zarina.
Hi, everyone. Thank you so much, Dr. Dawn, for having me this evening. I am Dr. Zarina, also known as Dr. Z, affectionately known as. I'm an integrative pain management and sports medicine specialist. I help individuals and groups and corporations go from pain to pain freedom long-term so that they can truly understand that they're the MVP of their life and their wellness. I do this through my books and concierge medical practice, as well as consulting, as well as CEO of Rebound Sports and Rehab, where I help individuals exactly going from function and improving their function in pain, and CEO and founder of Nature's Freedom, an all-natural, non-GMO supplement line. Thank you for having me.
Thanks for being here, Dr. Z. Dr. Lakeisha.
Hello, everyone. I am Dr. Lakeisha, a board-certified OBGYN in Mississippi, specializing in helping women who are struggling with life, sexual dysfunction, and self-image. Through my programs, products, and integrative medicine, I help women live powerful, passionate lives. Thank you for having me, Dr. Don.
Thanks for being here, Dr. LaKeisha. Dr. Donald.
All right. Good evening, everyone. My name is Dr. Donald Brown. I'm brother of Dr. Dawn Brown, but I received my training in general psychiatry here in Los Angeles, California, and also specialize in forensic psychiatry, which means integration between mental health and the law, which I do in a private practice basis. I also talk about mental health topics on the Daddy Issues podcast with comedians Tony Baker and 𝘄𝘄𝘄𝗶𝘃𝗵𝗃𝗍. You can check out on YouTube. And I also started an organization with my wife and other members in the Los Angeles community called the 𝘄𝘄𝘄𝗄𝗍 Project, UJIMA Project, where you can find on Instagram, where we basically tackle projects that empower and improve communities of color through basically social justice projects, through community beautification and other projects such as that. So thank you for having me on tonight and looking forward to the talk.
Awesome. Thanks for being here, Dr. Donald. Dr. Alexia.
Hello, hello, hello. I am Dr. Alexia Gaffney Adams, known as Dr. Alexia, triple board certified infectious disease physician. I am trained and boarded in internal medicine, general pediatrics, and infectious diseases. And outside of my office, I am a mom, a speaker, an author, a cancer wellness coach, and a breast cancer survivor thriver. I create healing pathways so that others experience total health and wellness, mind, body, and spirit. Thank you so much, Dr. Dawn, for having me on, and I am in great company with you all tonight.
Thanks for being here. Dr. Jared.
Hello, everyone. Thank you so much, Dr. Dawn, for having me. I am Dr. Jared, a comprehensive cosmetic and implant dentist right here in the ATL. I am passionate about all things related to dentistry. I consider myself the Picasso of dentistry because dentistry is truly an art form. Not only am I a comprehensive cosmetic and implant dentist, I'm also the founder and CEO of Honey Envy, a natural hair care line catering to all textures because regardless of texture, all hair should be envied, honey. But for the purpose of tonight, I am strictly Dr. Jared the dentist.
Thanks, Dr. Jared, for being here. Dr. Napoleon. Uh-oh, Dr. Napoleon, we can't hear you.
Hello, my name is Dr. Napoleon Higgins. Sorry, I was on mute there. I'm a child, adolescent, and adult psychiatrist from Houston, Texas, born, raised, and I practice here. I am CEO of Bay Point Behavioral Health Service, private practice in Southeast Houston. Also CEO of Southeast Houston Research Group, where I do research and clinical trials. And then also CEO of Global Health Psychiatry, where we do books, write curriculum, and do talks about mental health, specifically Black mental health. So I'm also a serial entrepreneur as well. And it's great to be on here tonight to be able to share. Thank you.
Thanks for being here, Dr. Napoleon. Dr. Sam.
Hey, everybody. Thanks so much for having me, Dr. Dawn. I'm Dr. Sam Price, affectionately known as Dr. Sam. I'm a board certified and licensed naturopathic physician. So this means I'm an expert in natural medicine. Through my #1 best-selling books, my concierge medical practice, and my live event, Vital, The Experience is a 2-day international wellness retreat, as well as my concierge coaching program specifically for physicians to teach them how to create a concierge cash-based practice of their dreams. I'm also a wife, a mom, and now a homeschool expert. Through all of this, I help you to bridge conventional and alternative medicine to transform your illness into wellness. You can follow me on all social media at drsammnd.com. So that's Dr. Sam, DRSAMMND.
Awesome. Thanks for being here, Dr. Sam. And last but certainly definitely not least, Dr. Nicole.
Hey there, Dr. Dawn. Thanks so much for having me. Love to be back. I am Dr. Nicole Edwards, also known as Dr. Nicole D.O. I am affectionately known as the Veterans Doc. I am a board-certified family medicine physician. I specialize in managing and treating chronic medical conditions and explaining those conditions to folks in terms that they can actually understand. I've got a concierge medical practice, Abundant Life Concierge, and with that, I take care of busy professionals, parents, veterans, and anyone who has limited time and wants to have a practice of convenience. It's a cash-based practice, so you don't need insurance to come see me. I'm also the CEO and founder of Abundant C&P, where I specialize in helping veterans to maximize their VA disability claims. And I also started a natural healthcare line called Abundantly Natural, where I reach out to help heal all people, especially veterans, mind, body, spirit, through natural supplements and a natural process. Thanks for having me.
Awesome. Wow. Did y'all see? Y'all see why I have these fabulous doctors here on with me? And we're going to make sure that you get all of their URLs and how to contact and connect with them after we're done with the live event this evening. So Dr. Stephen, I'd like to start with you. Dr. Stephen, what is your main point? If there's anything that you could tell our communities and what we need to be doing over these next few months, weeks, years, what would that be?
Yeah, great question. I think the main point is stay vigilant. Initially when this coronavirus came out, I had the thought that it was going to be 2022 until we would get back to some sort of normalcy. Unfortunately, the way that things have progressed, it's looking to be 2025. And I'm sure that we'll get to some of those discussions as to why, but first and foremost, we have just allowed the virus to reach exponential levels. And if we're not careful, I fear that we're really going to be looking at 1918 pandemic numbers in which we had 670,000 individuals die. At that time, masking up was the thing of the day. If you did not wear a mask, you were fined, you were potentially arrested. Things of kissing in public, holding hands were outlawed. So we have to be vigilant, and we have to get in our mindset that this is going to be the foreseeable future until we have a change in leadership, but more importantly, until we have a societal change. What I do affects everyone else on this panel. And so we all have to take it upon ourselves. Never really in history have we been affected by something in which what I do affects everybody else around me. So most importantly, stay vigilant, stay masked up. I know that we're tired, but we have to continue. The other thing is that people need to listen, the Black community needs to listen to reputable resources. And as we heard early on in the pandemic, a lot of those institutions that we thought that we held up to be, the end all be all just, failed us, frankly. And so what that leads us with is institutions and platforms like yours, being able to get the word out, being able to trust those institutions that have always represented the Black community. The National Medical Association, the Association of Black Cardiologists, SNMA, and other organizations. Those are the organizations that we really need to listen to at this point in time, because those are the organizations that have our back. And so when it comes time for the vaccines to come out, and as they start to come out, there's going to be data that we need to look at. And there's data that's currently being reported. But I'm looking to see what the results are and what the study and the investigation have been done by the National Medical Association and their task force, because I know those individuals on that task force and they're squared away. Thank you.
Awesome, Dr. Stephen. Awesome. Thank you for that valuable information. Dr. Zarina, what are your 3 main pointers that you would like to bring to the community today? Let's start with how to gather for the holidays.
That's a very, very big one, because it comes up so much, in particular with the patient population that I deal with, which goes from, honestly, from the 20s to the 80s. But more importantly, one of the most vulnerable populations that I'm currently treating is in our 55 and up, because they're coming off of to our rehab units. And these are patients who may be coming off of knee replacements. They may even be post-stroke. You name it. And unfortunately, because of the times now, people are getting more and more anxious, wanting to gather. We've had so many situations currently where family members want to take their loved ones out of the rehab, when really that's exactly where they need to be. The vulnerability has not changed because of their demographic. Just because the season is here, but they're still amongst that vulnerable demographic. So I think we have to start being a little bit more creative. I know it kind of sucks. Am I over this thing? Yes, I am too, like we do. But just like Dr. Steve said, we have to stay vigilant, and we have to create a culture of caring and looking at it from all perspectives, and not just what you want, but what is in the best interest of actually everybody. And I know that's a hard thing to do, because unfortunately, as in America in general, it's kind of a me. but we cannot afford it because the me mentality is literally going to, again, lead us into 2025. So one of the big things that I've been trying to help people understand is that we can be creative and still create those bonds when it comes to gathering. It may be a thing of that you're gonna make food and do it over Zoom. That's actually something my family we're gonna be doing this year. We're gonna create recipes and actually cook and make it live and connect everyone. Bonding can still happen. And if your loved one happens to be in the rehab unit or a nursing home or something like that, make the food. You can still, many of the facilities are actually allowing you to drop off that food so that you can still feel a bit connected. There's window visits and things like that to still feel connected. Increasing the live FaceTime in those settings as well. We just have to be a little bit creative and stay vigilant because that's truly a piece that we just can't afford to like get lax now. The numbers are indeed increasing. We've seen that, and we can't pretend that they're not. And there's a reason they're actually increasing, very much so what our physician colleague just mentioned. There's a reason because it has everything to do connected to our behaviors. And so I just encourage everyone to really, truly, really just get into a creative mode, quite honestly, and think about ways that you can still create bonds without necessarily being amongst each other. Still masking up, still social distancing while you're masking. I hear a lot of discrepancy about that. People say, well, I'm masked, so they'll stay this close to each other. That's really not the point specifically. That's not the end all be all. We want to still create those masking and social distancing. And there are some ways to do that. I've seen some events where they kept it at about 20, but they may spread apart where the tables are only of the people who live in that home. And so you're eating together, but you're not eating together, but it's still a way for you to feel like you're communing. And again, when you're done eating, you get up from the table, you put the mask back on and still create, again, memories. So there's definitely ways to kind of, still gather and create those bonds, because I know this can be a very, very touchy season for a lot of people, but I say we'll start there. Another piece that I really want to reiterate is when it comes to prevention in your immune system and doing the things 365 and not looking at it just from in a acuity standpoint. We a lot of times, us as not as physicians, but our people, our community, maybe even our aunts, our uncles, we see a lot of times where once they're reactionary, we want to be looking at it from a prevention and not initially just intervention, right? And that's a really, really big thing that I try to stress with people. Like, don't wait till you're in trouble. Let's try to do things on the front end, especially during this time of season. We know that it's going to hit flu season as well, along with the COVID-19. Sometimes things can mimic each other, and that's the things I want to stress, that don't minimize your symptoms. I've had over and over again so many patients and family members, if you're there, who say, I'm asymptomatic, but they end up being COVID-19 positive. But were they truly asymptomatic? Having headaches that you normally don't have, that's not truly asymptomatic. Having an unexplained rash without any other symptoms, that's not asymptomatic. Being overly fatigued, and that's not normally your situation, that's not asymptomatic. Having diarrhea for a couple of days, that's not asymptomatic. So we have to take ourselves and not just look at cough, just looking at fever, just looking at I can't breathe. Those are the three that came out the fastest, but those are not the only three symptoms that we need to be paying attention to. So anything that's out of the ordinary, we have to stay hypervigilant and ask the questions and look to the resources that we just talked about that are reputable to really give you information that is actually sound, so that we can be doing a better job of taking care of ourselves, being preventative, being hypervigilant, but still being creative and still creating those bonds.
Dr. Z, you mentioned so many fabulous tips and facts and advice. Thank you so much for bringing that to the forefront. Did you also, I'm not sure if I missed it, how about for those families who are actually gathering indoors, like in the state of Michigan, my home state, where it's cold outside, if they're not able to, have outdoor events? Do you recommend anything for proper ventilation or any type of situation for small gatherings indoors?
Absolutely. If you happen to do that, I actually discourage it, quite frankly, to be honest, but I know people are going to try to do their best. Still try to create some indoor activities, because like I said, some places are cold and they refuse to not be together. So that's going to happen. Like you just said, you want to make sure that it's well ventilated. You want to reduce the numbers that are in a particular room. So if you are eating, please spread apart. I would advise, I don't care how big your house is, even if it's a 5,000 square foot or 1,200 square foot. Keep it less than 20, and definitely, again, try to spread out. And also, believe it or not, if you don't live together, still strongly consider wearing your mask. That's extremely important. Again, our population, young, old, it doesn't matter. We still know that COVID-19 can be spread from asymptomatic carriers to another person. We cannot minimize that. My husband just told me today as we were preparing for this live how he had a friend who was working as a plumber, and he was like ran into the client he told him I had COVID-19, and he was like, that exists? Here we are just a week ago that said that. This thing is still not really clicking to everyone. So I cannot stress enough. If you know someone, I'm talking directly to whoever is listening to me right now. If you know someone who thinks like that, please bring them to this live. Share this live. Please have them, because a lot of times our family doesn't like to listen to us, right? Even my own family, quite frankly. It's like, oh, it's just Dr. Z, right? But we really want to try to make sure that they get this information, because this is real, and it really does exist.
That's so true. And as of noon today, let me give you some stats. So as of noon, there have been 11.2 million total reported cases of COVID-19 in the United States. Over 135,000 new cases in the past 7 days. The total deaths have been over 246,000, 8,000, over 8,000 in the last 7 days. All right, you all. This thing is very real. And many of the states like Texas, Florida, Illinois, Georgia, these are the top risk states that have had new cases over the past 7 days. So I would even advise looking to see if you're planning to travel, look at those state laws, look to see, because Michigan, as of this morning, did some regulations and laws and shut down a lot of things going on just to help control the virus. You may be in a situation like you were a few months ago where you were trying to come from Louisiana to Texas, or Texas, Louisiana. You had to actually quarantine, or you weren't allowed in. So there's certain states that probably will be there, because Thanksgiving is next week, right? So you definitely want to pay attention if you are traveling or plan to travel. Be aware, be vigilant, but also be prepared that your travel plans can actually change based upon state laws as well. Thank you, Dr. Zarina, for that awesome information that you shared. Really appreciate it. Dr. 𝘄𝘄𝘄𝗶𝘃𝗄𝗶, why is it important for pregnant women to get flu vaccines?
That's a great question, Dawn. So even before we were in the midst of the COVID-19 pandemic, the influenza has been a major factor in mortality for pregnant women for years. Every year, 24 to 34% of hospitalizations are pregnant related. You know, being pregnant, the changes in our immune system, it makes us more vulnerable to influenza viruses. So actually, the flu vaccine is a part of our standard of care. ACOG recommends that all pregnant women receive a flu vaccine during flu season. Now you're in the midst of a respiratory pandemic, and we already know that you can have influenza and COVID-19 at the same time. So when you're battling a pandemic where you're going to be on the vent, where you're going to have shortness of breath, you're going to have cough, imagine having two viruses in your body at the same time while you're carrying a life. You know, we already know that women die from influenza. We know that women are dying from COVID-19. And to have both of those at the same time could be deadly for both mom and the baby. So what we're recommending right now, which is what we always recommend, is that get your flu vaccine as soon as possible. Flu season started in October. If you have not gotten your flu vaccine, you need to get your flu vaccine. But also family members in your house. You know, if you're pregnant right now, if you have children, you have a spouse, everyone in your household needs to be vaccinated, because just because you got vaccinated, they can still bring the flu home to you. You know, we're only covering the most common strains, but you can get influenza A, you can get influenza B. So we want to make sure that everyone in your household is protected as much as we can from influenza.
Very good advice to give, Dr. 𝘄𝘄𝘄𝗶. We often miss that everyone else in the house, if you are amongst a pregnant woman or other high risk population or groups, that it's important that you get your flu vaccine. So thanks so much for reiterating that important stance. How about the risk for COVID during pregnancy, Dr. 𝘄𝘄𝘄𝗶? Are women at higher risk if they are pregnant to acquire COVID? For that?
Absolutely. So ACOG has included pregnant women in the increased risk group for COVID-19. So, you know, when COVID-19 first came out, we were talking about people with diabetes, morbid obesity, autoimmune disorders, but pregnant women had been included in that category. So when COVID-19 first came out, I think pregnant women were extremely afraid. So they were probably more cautious than any other group just because they were carrying a life. But I have seen them become more lax since we have come out of quarantine. I have seen the baby showers. I have seen the family over after the baby's been born. You know, we've quarantined moms now that they can only have one visitor in the hospital, and families are upset about that. You know, they want 3 and 4 people in the room during childbirth. You know, so I really encourage my pregnant women to realize that you are part of the increased risk for COVID-19, especially if you are morbidly obese and pregnant, or if you have diabetes, pre-existing or gestational diabetes. That increases your risk of being symptomatic from COVID-19. Women who are symptomatic with COVID-19, we're seeing an increased risk in ICU admissions, ventilation, and death. So like you said, COVID is still here. And, you know, I think the thing that has gotten us to be so lax is that people have had COVID-19 and didn't require hospitalization. So that group now makes it seem like, oh, I had it, I was fine, I didn't have to take any medicine, or I didn't even feel bad, or I was better in 3 days. And, you know, that has changed our mentality for the worse, unfortunately, as it comes to how we see COVID-19.
Yes, you're exactly right, Dr. 𝘄𝗄𝘄𝗶. Even in our leadership positions of those who've had COVID-19 and all of a sudden they say that they're doing fine. We also know that there are long-lasting symptoms, which we call sequelae, that often happen and resolve. I mean, I have a friend who still can't smell her food or taste her food, and she had COVID in January. And didn't find out that was COVID till later on, right? So yes, you're exactly right that it's important to recognize that this is still real, it's still evident, it's still out here, and we have to be vigilant. Thank you, Dr. 𝘄𝗄𝘄, for the information you shared. Dr. Brown.
Yes, ma'am.
Hello.
What's up?
What is it important to stay connected? However, I know that Dr. Zarina mentioned this a little bit, but why is it important to stay connected during COVID or during the holiday? Excuse me.
Yes. So if this was a non-COVID year, I would even be, as a mental health professional, I would be more vigilant and hypervigilant with my patient population. Specifically, the holidays are a lot of times trigger anniversaries, usually anniversaries of spending time with your family as a group. And I'm talking about Thanksgiving, Christmas, Hanukkah, Kwanzaa, whatever religion or holiday you celebrate. But also just deaths, just remembering past family members who were there. So when patients used to come to my office, recommendations I would give basically like get around this community, get around your support system, and you know, kind of remember the good times with your family members and doing things of that nature. But since we're in a COVID year, we have to adjust. And things like Dr. Z had said, Dr. Steve, Dr. 𝘄𝗄𝘄𝗃, and yourself, very important to consider. Something we can do nowadays, or like what Dr. Z mentioned with Zoom meetings and getting creative with that, having family dinners, checking in is very important. I would start now, if you haven't already, checking in with those members in those vulnerable populations that Dr. Z had mentioned. Just seeing how they're doing and letting them know, hey, I might not be able to come this year. I shouldn't come this year. But just remember to stay connected. One thing you can also do if you're in your community where you aren't around family, checking in on your neighbors, specifically those who are vulnerable or just other friends. And that could be via Zoom meetings, or it can be preparing your favorite dish in bulk, knocking on the door, leaving it in the stand and going away and doing like a modified potluck in that sense. Getting a group of people together, you make a bunch of peach cobbler, a bunch of greens, whatever your specialty is, have a bunch of other people make their big dish in bulk and just exchange, and doing it in a socially distanced way. That's something that can happen. And then meeting on a Zoom chat, like Dr. Z mentioned, and just having a good family, friend type of dinner, type of gathering. That's something I would just recommend for any patient, because the social aspect is just as important as the other symptoms that you're treating with depression, with medications, with therapy. So we have to engage that part equally, if not more, as the other parts. Another thing that I would tell my patients too is remember other people in your situation who might not be as well off as you. So I would recommend volunteering. I would recommend giving to local food banks, food shelters. And that's something I've done past years too. It could be something that's not only helpful for your community, but it's helpful for your own mental health, your own psyche, your own symptoms of depression, anxiety, bipolar, schizophrenia, whatever you're possibly going through. I know a lot of communities, especially shelters, are in need of a lot of donations, especially now, volunteers that they used to have, because they used to get a lot of influx on volunteers, especially in the Thanksgiving holiday, Christmas holiday, they can no longer do. But they're still in need of the actual donations, whether it be monetary, whether it be food, whether it be toiletries. Feminine supplies are in big demand. So if you can, just take the time out, buy these things in bulk, and drop them off at local charities, local food shelters, things of that nature, because helping other people in community can also help you personally in your day-to-day. As well as, I know some of the other doctors mentioned, do not be afraid to open up and let your physician, whether it be a psychiatrist or you're just primary care physician, know what's going on with you. We have to know that the problem exists in order to solve it. So if you're having symptoms of depression, anxiety, if you're having, what I mean by that is low mood, not enjoying things that you used to enjoy in the past, sleep changes, appetite changes, feelings of wanting to hurt yourself or wanting to, a longing to be with that family member that might have passed on, please share it. The last thing we need is for you to do something you might regret, and especially being reminded during these holidays and not being around that family social support, it's going to be even more important to share. Just so you know, I don't want to put panic out, but since this pandemic, there's been a rise in mental illness, specifically those diagnoses I described earlier. And they've noticed that there's been a shortage of certain medications in certain areas. So as such, please make sure when you talk to your medical professional that you can get enough supply to get you through the holidays. As the professional, they need to assess and evaluate to see if you can take on that additional medication, because of course, if you have too much, there's other risk involved with that. But just make sure that you're covered, make sure that you check in with your doctor, and just make sure you're vigilant, not only with your own health, but the health of those around you and the health of the vulnerable population, specifically homeless populations in the areas that you live.
Very outstanding points, Dr. Brown. Thank you. Thank you so much for those comments and recommendations. And I definitely want to extend that to anyone who's on medications, especially around the holidays. We know that the holidays is a very busy time for doctors' offices, for pharmacies, for backflows of medicines getting to pharmacies because of COVID and the mailing system and all of that. So if you are on the mailing system or you are expected to get your medicines at the pharmacy, make sure you get those early on. There are insurance companies, even for controlled substances, that will allow you to get those early on, especially around the holidays, given your situation. So all you have to do is just contact your insurance company to get that coverage, or contact your doctor's office for more information. Thanks again, Dr. Brown. Dr. Alexia, so we're hearing about this vaccine, right? There's a lot of news about it, especially on today. I heard there's nothing but vaccine, 97.4% effective, all this, all these kind of things. What should we know as a triple board physician, Dr. Alexia, an infectious disease specialist? What should we really know about this vaccine that they're telling us in the news? What are your thoughts around this?
Yeah. So I want people to not be so hesitant or reluctant to consider getting vaccinated for COVID-19. Yes, most people will have a mild infection, but as we know, we vaccinate ourselves for communicable infections because we don't know if we're going to be the unfortunate small percentage of people who's going to have catastrophic illness, have, really terrible sequelae of an infection. We've seen this in the past with many viral illnesses, chickenpox, measles, mumps, rubella, etc. Right? And so we do it also for the same reasons we're wearing our mask and washing our hands and staying home, to protect others in our homes, to protect others in our community, our general population, to protect those that are most vulnerable and most likely to die or have devastating impacts from this infection. So, remember why we vaccinate. Yes, this is a new vaccine, but something I have to remind people, and I have to be honest, I had to remind myself of this when there was first talk of a vaccine. The production of vaccines is not new. Right? We've been making vaccines for decades. We know how to produce vaccines safely. We know what works and what doesn't work in terms of having certain preservatives or certain compounds within the vaccine solution to keep it safe or give it a shelf life. We know over the years of giving vaccines and doing vaccine research that certain things don't work for the general population. And so certain preservatives, thimerosal, et cetera, have been pulled out of vaccines. Vaccine technology is not new, and the vaccine isn't necessarily being rushed as people are suggesting. The thing or difference here is that we've never watched a vaccine be produced in real time, right? We have no idea who's working on a vaccine. We don't necessarily have a particular vested interest in a vaccine being produced because that doesn't impact me, or I can choose to opt out of that because the infection isn't that bad, or, you know, there's still herd immunity, like true herd immunity, because other people have been vaccinated or had the infection. So it doesn't matter if I get it. But now with the whole population being at risk and herd immunity being a dangerous thing to try to achieve in the absence of a vaccine and being nowhere in sight, you know, this is something that we really have to consider for our future and to try to get a hold and slow down this pandemic. So points that I want to emphasize is that, you know, vaccines are not new. We know how to produce vaccines. The vaccine, even though these vaccines have been reported, 2 of the 11, 12 strong contenders as being efficacious, meaning the early studies are suggesting that they work. Keep in mind that no vaccine yet has an FDA approval. They still have to go through the FDA approval process, right? The manufacturers, Pfizer, Moderna, BioNTech, the ones that have data, they are still themselves waiting on the safety information to be evaluated. So all of those things have to take place before there is an FDA approval and before anybody releases a vaccine to us. And so, you know, we still have time. They're still looking into this. So people don't have to feel like, oh my God, this vaccine is being rushed. They're going to just give us any old thing and that they're not checking it for safety. All of those things are being done. All of those things are happening. It's just you never watched it happen. Nobody ever politicized it. And typically what's happening that's being done simultaneously right now is the vaccines are being studied and the millions of doses or ultimately billions of doses that we will need are being concurrently produced. And what these vaccine companies are doing is they're basically willing to take a huge loss on if their vaccine is not effective, if their vaccine is not safe, then they're just going to scrap those millions or billions of doses that they're producing. But the last thing you want is to be in November 2020 saying, yes, we have a vaccine and it appears to be very effective. And then in a few weeks in December, no, this vaccine is safe, and then have to tell the people, but wait, we don't have no doses yet. It's going to take us 6 to 9 months to produce them. So y'all just, hold your brakes and keep your mask on and do the best you can. So they're doing all of these things concurrently, but understand if a vaccine is not efficacious and if it's not safe, then the company is going to take a hit, and the vaccine that they have on hand, they're just going to have to throw it in the garbage, literally. So I just want people to know that and be mindful of that. Like, just take a step back and think it's not brand new to produce a vaccine.
And thank you for highlighting this important topic, Dr. Alexia, because I believe that for some people, this is leading them to not want to get the vaccine when it is available to them. Yeah. So I think this information is very important that you shared with us. Dr. Alexia, do you feel that the state recommendations that they're making for economic growth or economic decisions that they're making, do you feel that they're just as valuable as the public health decisions that are being made for our populations?
Well, I'm biased. So for me, nothing trumps science and public health and public safety. So I have to remind my patients that there are economic and financial decisions being made. There are political decisions being made, and then there are scientific and public health decisions being made. And those things don't necessarily align with one another. So yes, your local restaurants and bars may be open, but that does not mean you should go sit down in there and eat, because your risk of getting COVID is 2 times higher if you go sit down and eat inside of a restaurant. So while I want to keep my local economy going, I support my local restaurants and small businesses by doing takeout or getting an Uber Eats and tipping the driver and the restaurant a little more than I would if I was sitting down in there, because I understand that they have bills to pay just like I do. So I want the economy to run and I want the economy to function, but I'm not going to do it at the cost of my own health and well-being. And so, eat out, have the food delivered, pick it up, do a curbside delivery. We eat out, but we eat in, we get restaurant food and we eat it in the living room or we eat it out in the backyard while the weather is warm, and we're trying to make the best of a bad situation. If you want your gym to be open in however long it takes for COVID to slow down and, whenever the economy recovers, then keep paying your gym membership. If they have outdoor classes, then participate in those. If they Zoom or stream their classes, then participate in that. But going to a gym and exercising in there with no mask on is incredibly high risk. Not only are you working hard, you're breathing in air that other people have been breathing hard in. If they're sick, you're touching lots of equipment, you're wiping your face, you're wiping your brow. And so it's not worth it. So we can do things to support our local economies, but we don't have to put ourselves at risk in order to do that. So, the top 4 risky things to do: eat in a restaurant, go to a bar, work out in a public gym, and sadly attend a house of worship, because we're not using discernment. So if you do
say that again,
right? Faith without works is dead. And, I believe wholeheartedly in God. And I believe that, we have to do our spiritual work and that we need to take care of our spiritual health as well as our physical and our mental health. But if you are going to go to church, don't go to church with y'all in there shoulder to shoulder, wear a mask. Stay home if you're sick. Encourage your church members to stay home if you're sick, or just, this is the one time you could do bedside Baptist, right? Screening on the Zoom, the Facebook, the whatever it is, however your church is giving it up, okay? But we have to use judgment. We have to use discernment. And again, I say it all the time, faith without works is dead. Sometimes your work is to stay home and pray. Sometimes your work is to put on a mask. Sometimes your work is to not go to church so the ministers and the mothers can be there and you just stream it from home, right? Mail your tithes in, pay your offering, whatever it is that we have to do, but know that is something that is right now a risky behavior.
Yes, I was going to say that. And I have to say shout out to Wheeler Avenue, Friendly Temple, Grace Emmanuel, all my churches in 3 states. I love you all for doing that, for making sure that you are virtual, that you are for Wheeler anywhere, wherever, that you pay your tithes to your church home, check on the elderly community of your church, the sisters, the bros, the ministers, the deacons. But yes, make sure that you do that bedside. Thank you so much. Thank you, Dr. Lexia. Oh, one more question, Dr. Lexia.
Sure.
Thank God and congratulations on being a cancer survivor. Congratulations, Dr. Lexia. We are truly, truly honored to have you here representing all of our cancer survivors here tonight. So God bless you. As a primary care doctor, as well as a cancer survivor, what are some of the tips or recommendations you would advise cancer survivors or those who may be at risk or immune compromised, those who are still taking medicines every day? What are some of the recommendations that you recommend for them?
So absolutely stay on top of your screening and stay on top of your general health care and stay on top of your cancer care. As someone who is, seeing this thing from the perspective of an infectious disease expert, a primary care provider, and someone who falls into that vulnerable population, there are just so many ways in which we can get caught out there and have other negative impacts from the COVID-19 pandemic that are not directly related to infection. Right now in the United States alone, breast cancer diagnoses are down by 50%, not because cancer got COVID, not because breast cancer is any less prevalent, but because women are not primary doctors. They're not going to see their OBGYN if they're not pregnant or acutely ill. So they're not getting those usual reminders of somebody, you know, saying, oh, I noticed I don't have a mammogram, or, you know, you didn't have your colonoscopy in the last 10 years. For our brothers, you know, Black men especially, Latino men especially, right? They're more likely to have prostate cancer. And so while the general public may not be getting PSAs and prostate checks, for our brothers, that is still the norm. So many people are not getting routine cancer screenings, not getting routine healthcare, not, you know, simple things, not getting blood pressure checks, not getting their A1Cs for their diabetes, because people are afraid to come into doctor's offices. I will tell you that we screen so vigilantly to make sure that our offices are safe and clean, so that our patients can come in and get their routine care. We don't want COVID to be so disruptive that people's blood pressure is out of control and they're stroking out or having heart attacks. We don't want you laying at home writhing in pain and not dealing with and addressing any symptoms because you're afraid to show up for medical care. You know, telehealth has rolled out in a way that you can't even believe. In my practice, I was trying to get enrolled in telehealth for 7 years, literally since the day I opened my doors. And my affiliate institution, when COVID hit, we had telehealth in 2 weeks. Okay, so telehealth is widely available. Please do utilize it. Insurance companies are making lots of exceptions, and just call ahead, be cooperative, be patient with your doctors, answer the screening questions. You know, there's a lot of parking lot waiting rooms right now. You know, just be patient and mindful of that. The same way your doctors are wanting to take care of you and give you the best care, make sure you are following the rules and doing the things that you can do so that your community members, your family members, you know, your population at large can get the care that they need. You know, early on in the COVID-19 pandemic, just by very conservative estimates, it was estimated that there would be an excess of 35,000 unnecessary breast and colon cancer related deaths. And that was just in the year of 2020. That number, I'm certain, will expand, because I don't think that anybody anticipated that we would be seeing people get screened 50% less than they would pre-COVID. So please do go get your routine healthcare. Please do go get your routine cancer screenings for things like mammograms. Oftentimes you can show up at the radiology place even without a prescription, as long as you have a provider whose name you can give for that. So please, if you've gotten behind the 8 ball, call and schedule those routine cancer screenings, those routine health visits, and just work on ways of, you know, decreasing your COVID risk.
Man, thank you so much, Dr. Alexia, for that valuable information. We really appreciate you being here this evening. Thank you again.
Thank y'all.
Yes. Dr. Jared, listen, I've been to the dentist 5 times in the past 3 months because I did not get my routine cleaning over the past 2 years, Dr. Jared. Yes, I've been a bad patient. But the World Health Organization initially said that, hey, dental routine cleaning is not important. You should stay at home. You shouldn't have it. Did who get it wrong, Dr. Jared?
Who got it completely wrong? You know, here's the reality, and everybody on the panel will agree with me. I believe in evidence-based medicine. I believe in evidence-based dentistry. You got to show me. You can't just be talking out of the side of your neck saying one thing without actually giving me proof or the evidence of these things. And so who got it wrong? And the reality is I've not heard of anyone getting COVID from any dental office. Let me be very, very clear. There are no stories of someone getting COVID from a dental office. And the flip side of that is, if I'm not scared to see you, then you shouldn't be scared to see me, because I'm at greater risk of getting it from all of you all on the outside than you are of getting it from me, because my office is a more controlled environment. Your dental office is a more controlled environment. So things are a lot different inside the dental office now than it was before COVID. A whole lot different. And I, for one, was not coming back to my office if I didn't have the proper PPE and proper measures in place to make the office safe. Not for you, for me. Sorry, I'm selfish. I had to make sure that I was protected and covered. And if I'm protected and covered as a dentist, then I know everybody else coming into my office will be as well. So who definitely got it wrong? Who?
I love it, Dr. Jared. Dr. Jared, what should we bring in our bag, our man bag or our purse when we come to visit you? What do you think we should put in there?
So here's the deal. You're going to have to pack your patients. When you come into the dental office, because you know what, for me and a lot of dentists, we were off for a very long time. Keep in mind, we were not considered essential. And so we had to shut our doors. My office, JLM Dentistry, shut its doors for a full 3 months. I came back strong thinking that I can make up for 3 months and 3 weeks. And here we are months later and I'm still swamped. And we are definitely asking you to pack your patients. Why? Because things are drastically different. I'm not seeing as many patients now because I want to decrease the risk of COVID getting into my office. It's a process. You have to be screened before you enter into the office. If you don't pass the screening measures, then you're not coming into the office. And even still, we're taking our time when we see our patients because we thoroughly clean before you sit into the treatment room, and we clean after you get into the treatment room. So you definitely have to pack your patients coming into the parking lot of the office because my waiting room is closed. And you have to also pack your patients when scheduling your dental appointments. Unfortunately for me, I have procedures that are booked out until June of next year because it's a blessing, but yes, it is a problem. But honestly, it's a problem that I just can't fix right now. I'm not concerned about fixing. I'm more concerned about keeping my office safe. And so with all of that being said, I'm asking on behalf of all the dentists out there that you do pack your patients when coming into the dental office, as well as when scheduling your appointments. And above all else, and I'm going to say this because y'all ain't going to say it, COVID has brought some real testy folks and yeah, I mean, a lot of people have really forgotten what grace is. And as providers, our number one goal is to make sure that you are healthy. But that's not going to happen. Like, this is like, we make sure you're healthy. We are passionate about what we do, but we're going to have to draw the line at some point. If you come in with attitudes because you can't get this and you can't get that, this is not a Burger King type situation in these offices. You can't have things your way. And furthermore, we have to take care of the patients that we have in the chair at the moment, at that time. We can't push people aside because you want to get something done immediately when it's not a true emergency. Listen, we're going to make a way for true emergencies. But other than that, I really, really ask that you pack your patients with, especially dentists, because we're really doing the best that we can with what we have, given that this situation and circumstances is completely foreign to all of us. And so we're trying to make a way and get you the service and dental care that you need, because we know that y'all have been very, very laxed when it comes to taking care of your oral health at home. And so we're grateful that we're able to get back into the office and provide you the care that you need, the routine care, the emergency care. But packing your patients is definitely something that you are going to have to do. It is what it is, y'all.
All right. Thanks, Dr. J. Thank you. I appreciate you sharing that valuable information with us as well. And I'm back on top of my dental appointments.
Yes, everybody should be, because we're safe.
Exactly. Dr. Napoleon. So, Dr. Napoleon, a few questions for you. Why is COVID so stressful for people? Like, I know as a psychiatrist, as a general psychiatrist, a child and adult psychiatrist, you've seen a lot of patients, and you've probably seen a lot of stress appointments as well. I know I have. Can you kind of talk about why the pandemic makes it stressful for people?
Yes, thank you, Dr. Brown. You know, as we've seen as psychiatrists, we're very busy right now. The doors are just being blown open. And mental health has always been important, but the volume of phone calls, the amount of people who just cannot get in to see a psychiatrist, and really what we're facing is the chronic stress that has now gone on, that's gone on now over months. It was one thing for it to be sudden, and me personally, I thought, well, we'll be ready by football season, definitely. Maybe we start the season late in September, but no, we are smack dab right in the middle of the funk of this thing. So so the stress has been there, and it's getting continually worse. We're continually getting more fearful, but also the losses are building up. And so the issue of everybody has lost something with this, be it your state of mind, money, finances, all of those things are being lost. The ability to gather and go around other people. So normally when you're stressed out, well, with us as Black folk, let's roll up into the church. Let's all hold hands and pray and lay hands on folk and all that. And all of that has been taken away. Our homegirls have been taken away. Homeboys being able to go to the bar and just chop it up with your old friend just to kind of let it out. And those
homecoming.
Oh my goodness, I was ready to get crunk. But all of that is just done. And that's just been hard. So we all are taking L's on this pandemic, and it just keeps rolling. I say it's like putting on the hits, man. The hits just keep coming. It's like Drake, it just won't go away. So, we are struggling. So the economic loss, the social loss, the loss of the community, loss of the religion, loss of being able to gather folk and celebrate our God, and all of those things have been taken away. So and then on top of that, the barriers of even being able to get in. I'm so sad that every day people are trying to get in. Please help my baby. And you're like, sorry, ma'am, I just cannot get anyone else in the door, because now we as mental health practitioners and all docs, we're now getting fatigued. I'm having to protect my own dome, from just the onslaught of the type of work that we're having to do. And then also us as practitioners, just the frustration with what is going on, and that these people don't have to die. This did not have to be this way, and it doesn't have to be this way. You can turn this thing around. You can turn the whole ship around in a matter of about 3, 5, maybe 6 weeks, and you can get this under control. And you see countries that are doing it, but somewhere in our Americanism or in our democracy, we feel like it's against our rights. And it's just frustrating us as public health individuals, as medical docs, to go out here and just watch people die needlessly when this can all stop. This can be stopped. So I think that has a lot to do with all the things that are going on. And then, of course, as we've talked about, people delaying care and treatment, and me as a psychiatrist trying to if I get you in front of the camera, because I haven't seen anybody in my office in a while. If I get you in front of the camera, I'm trying to help you through this medical situations that you have going on, even with yourself, because I know I've been trying to check blood pressures on people, and, I don't need my blood pressure check, doc. I'm feeling just real fine. And I was like, do you have a blood pressure cuff in the house? Oh, yeah, I got one. Let's check it. Blood pressure 160/112. I'm like, no, it's not good, because the stress is now adding up on every individual. So it's important for us to take care of our medical care.
Yes, Dr. Napoleon. Thank you. Thank you for sharing that. I've had 3 friends who've been hospitalized for psychiatric care, who are all physicians. So it's real, you all. It's real out here. Dr. Napoleon, I'm very aware of this stat. Is it true that Black children are at risk or at greater risk for suicide now during this time?
Definitely so. I refer you someone today, a young man who could definitely use your services, and especially that you have, even beyond what I do. And so we're seeing this increased risk within our children. It's been an exponential increase for the Black children over the last, say, 20 years. And now we're seeing it creep down into our youth. where we're starting to see people from young men and women from the ages of 5 to 12 who are now committing suicide. And this is a new phenomenon that is seemingly continually growing. So we have to definitely look out for these children, especially with the losses that they're having. Because as a kid, as soon as I played at school, I couldn't wait for recess. I couldn't wait for gym. Couldn't wait to play ball. We'd be sitting in class all day thinking about how we gonna pick teams and all that kind of stuff. I couldn't wait to get home because you had your school clothes, you had your play clothes, you had your school shoes and your play shoes and all that kind of stuff. And that was my whole thought. Let me get home so we could play football or kickball or whatever it might be. And then, the other part of that is that as an adolescent, the need to be around your friends, the need to be able to communicate, and this loss of identity development. Because essentially, many of us form our identity being the smart person, the intelligent person. We may be the cool kids, we may be the athletic kids, we may be the weird kids, but we all have our group that we have together that is formed between the ages of 14 and 24. You may be the lead dog, the ace, the tail dog. With all those things formulate who you are, and all of a sudden, that's all lost. And that's been a bit serious problem. So we definitely need to keep an eye on our children and try to address those needs and get them help soon versus waiting.
Thank you, Dr. Napoleon, for sharing that information. How can people go to get help for their children, Dr. Napoleon? Where do you recommend they go?
Well, right now, we're all virtual for the most part. Most psychiatrists are going to be virtual. A few are seeing patients in their office. So I would recommend, turn to Dr. Dawn Brown, also her brother as well, out there in LA. That was a forensic case I need to send your way. But making sure that you contact early. And honestly, I would say it's a good idea to at least get in to see a therapist or a psychologist or someone just to say what's up and just check in with somebody, because it's good to already have somebody before you need them. It's kind of like going in to see the dentist. It's best to go when it's not nothing big going on and your head you don't feel like something is shooting up through your skull out the top of your head there. So the point is to get in there, get in early so that there's at least a contact with someone in case there is a problem. But making sure that you get in to see a professional, realizing that sometimes there's an emergent need and you may have to access your partial hospitals, your IOPs, but even your emergency room, and do not hesitate to do that if need be.
Awesome. How about for those who are resistant to seeing someone, Dr. Napoleon? What can we do about our family members, our friends, or even ourselves if we're contemplating about seeing someone? Is there any advice you would give?
I would make sure that when you're talking to individuals that you be honest with what you see going on. And that if you see something, say something and say, hey, something doesn't seem to be the same about you right now. And what we find is ourselves as an individual, we almost take it as a badge to suffer. And I think that holds over from many historical years where we take it upon ourselves this is our burden that the Lord has placed on us. But, my God does not want you to be burdened. So my thought is I try to tell folk, if you notice that you're having the person is not seeing themselves, and I'll point out to people that you notice that you haven't been able to work or take care of your family, you're not on top of your game like you normally are, and you have your kids, the people who depend upon you, your job. And what I would recommend you doing is pointing out that you've seen these losses that have occurred, but also when we do it, let's try to make sure that we do it in a sincere way and we do it on a one-on-one. I wouldn't wait until we get to Thanksgiving dinner and start yelling out who's crazy and who's not. That puts a person in a very defensive mode. And I've seen where people feel like they need to have the come to Jesus moment with your kids inside the room talking about your business. Don't do that. All right. This is not television and this is not, Dr. Phil. So the thing is that you have to make sure that you approach people in the right way. And if they do need help, be willing to support finding them help. Go out there and ask, go and find them a psychiatrist. Hey, listen, I know somebody who's really good. And if they don't have the money, it's not like seeing a psychiatrist requires you to put a down payment on a car. You know what I mean? This is not something that you have to finance on a credit card. So the fact is that if you really feel that way about, your family member, your cousin or your girlfriend or whomever, and y'all really feel that way, you can actually help them do that for them, realizing that we want to make sure that not only do we want to talk about it in a sincere way, but also we want to be a resource to be able to help people get the help that they actually need.
Awesome. Awesome. Thank you so much, Dr. Napoleon. That's why you were one of my mentors. I appreciate you, Dr. Napoleon. Listen, you all, I believe Dr. Jarrett Hatchley said that her daughter is still virtual and she decided to meet with the school counselor every week. Hats off to your daughter, Dr. Jarrett. And I actually have been recommending that to a lot of college students, whether they're in elementary school, middle school, college, mainly because of transitioning, maybe because this is a new time for them. It's important, as Dr. Napoleon, I know, mentioned, to have these services in place even before something may happen, may not happen. Go ahead and establish these relationships now, so that you can have some support in getting through these moments as well. So thank you so much for bringing that point out. Yolanda Urquhart says that in Michigan, there are huge waiting lists for mental health. What strategies do you suggest to get a person the help they need? We definitely know there's a shortage. There's always been a shortage for mental health, and particularly now we can understand there's a shortage. I'm actually a part of Teladoc. Teladoc is actually an online platform that provides services for medical as well as mental health services for physicians who are licensed in different states. So Teladoc is a service or platform that uses insurance. They also have low-cost services for those who are uninsured. And it's just one of many platforms. I'm not here on behalf of Teladoc. It's just something I'm on, that I'm able to see people across states who need mental health care. And there are a number of platforms that are out there for mental health services as well. I don't know if Dr. Napoleon, Dr. Rashad, or anyone else can shout out a few, but there are a number of services and platforms. And all you can Google search is mental health online platforms, and I'm sure a number of lists of services will come up as well. Okay, so if you can't see someone in person or they're not there, there are doctors, especially during COVID, who have special licenses that can actually see patients outside of state, specifically for psychiatric care and therapy. All right. Thank you again, Dr. Napoleon, for that information. Appreciate you, brother. Dr. Sam, what supplements do you recommend that could be beneficial and are specific to COVID or building our immune system?
Okay, so specifically, let's talk about the evidence-based ones. Okay, so that's number one. They're the same 6 that I've been talking about since the very beginning. So some new research is out, and my opinion on some of them has changed. So I'll tell you what has changed, but the 6 are zinc, melatonin, elderberry, vitamin D, vitamin C, and vitamin A. So zinc specifically, right? So we've been talking about zinc since the very beginning. Zinc is amazing. We talked about, I don't remember who it was on the panel, but you talked about losing the sense of smell and taste, right, for COVID. That is a zinc deficient classic sign for a zinc deficiency, right? So if we make sure that our patients have the adequate amount of zinc, they might not lose that smell and they might not lose that taste that comes with some of the COVID symptoms. Zinc specifically protects our upper respiratory tract. And we know that COVID affects the upper respiratory tract, right? It also increases your immune system. And we know that it's effective against coronavirus, not necessarily COVID-2. So remember that COVID-19 is a novel virus. We don't know a lot about it, but we know it's in a family. It's in the family of the coronavirus. And we know that zinc is effective for coronavirus. So that's the reason why we recommend zinc. Melatonin is fantastic. So melatonin is that master hormone of the immune system. Specifically, I like melatonin because there is an inflammasome that we know is associated with COVID-19. I am specifically talking about the novel virus at this point. It is NLRP3, and melatonin actually decreases that inflammasome. We know that. There's studies for it now. It actually helps to decrease oxidative damage in your lungs. And interestingly enough, we know that melatonin is very high in kids, and we know it's low in the elderly. That's just automatic. And we know that kids are sometimes asymptomatic. I'm not going to say that they don't get it and they don't get symptoms, because we know that they do, and we know that our kids are dying from COVID. Okay, but we know that they have less symptoms, and we know that the elderly have higher or more severe symptoms. And we know that the melatonin has to do with that. Okay, so we recommend melatonin. Elderberry. So this is where my ideas have changed a little bit. So elderberry has lots of research specifically around coronavirus. Is antiviral, is antibacterial. There's a trial in vitro. We know that it increases the cytokines, and this is the reason why my organization suggested in the very beginning that it's okay to take elderberry in the very beginning to beef up your immune system. But once you're COVID positive, stop it, because we know that there's a cytokine flare or a cytokine storm, right? And we want to stop that, right? So I think that I'm still on that level with elderberry. But I want you guys to know that when we're talking about preventing things before you get it, elderberry is fantastic. We know that one of the sequelae of having COVID-19 is heart issues, right? And Dr. Steve can talk about this. And we know that that's down the line. We don't have enough data on it yet, but we're seeing it. And we know that elderberry has fantastic cardioprotective. It is a diuretic. It's a vasodilator because it has potassium in it. We know it's an immune modulator. We know it decreases blood pressure. We know that it has fiber, right? And that's going to help decrease that bad cholesterol. So if we can protect your heart in any kind of way, and I also told you that it's antiviral, antibacterial, why wouldn't we do the elderberry, right? Vitamin C, fantastic. Lots of research on it. Increase your immune system, antiviral. It also protects the lungs. And we now know that several of the ICUs around the country are using IV vitamin C, right? So that was one of the things that I talked about before that was just coming out when we first talked about it, right, Dr. Don?
Mm-hmm.
So we also talked about the fact that when you go home and you can't get an IV vitamin C, one of my tricks is to do bowel tolerance vitamin C. And I don't think a lot of people know about this, but bowel tolerance vitamin C is where you're getting your customized dose of vitamin C. So the way that I like to do this is I usually have my patients have powdered ascorbic acid, which is vitamin C. And you will have like a scoop, or it'll say 1/4 of a teaspoon is the dosage on the back. You're going to take that with food, because vitamin C can make you nauseous, with food. If you don't have diarrhea or abdominal crampings with that dose, the next dose, you're going to take a double dose the next day. And you keep increasing the dose until you have abdominal cramps or diarrhea. The day that you have that, you back down 1 dose. That is your customized dose. We are in cold and flu season. You need to be at bowel tolerance now, right now, okay? Vitamin A. Vitamin A at high doses, we know protects your mucous membranes. So we want to do that. It is too high when you get a headache that you can't tolerate. That's a vitamin A toxicity. So we're going to do that. So vitamin A is fantastic. And then vitamin D. Vitamin D is one of the ones that we know decreases that inflammasome, the NLRP3 that I was talking about. It also has a cytokine reaction that we were saying, don't take vitamin D because of the cytokine storm, right? However, the new research as of September is that, and I didn't even realize this, that vitamin D is actually not necessarily a vitamin. Did you guys know that? So it actually is a vitamin that is made from the sun or from food when it touches your skin. Then when it goes into your skin, it goes through the liver and the kidney. It is actually a steroid pre-hormone. And what do we give pneumonia? We give a Z-Pak, right? It is a steroid pre-hormone, okay? Vitamin D is absolutely amazing. The studies now are showing that the most severe cases of COVID-19 are actually the most depleted vitamin D levels. Those that have higher amounts of vitamin D actually fare better and may even be asymptomatic. The reason for this is that, and to make it very simple and not to complicate it, because y'all know I can make it complicated, is the ACE2 enzyme and the RAS system, right, Dr. Steve? Right. Okay. So that little, you know, the picture of the coronavirus with the little spike on it, that's your ACE2, right? So the vitamin D, if you want to think about this whole cytokine storm system, whatnot, it's like an engine with an accelerator and a brake, an accelerator and a brake. And what happens is our system's like very smart, and it says, push the accelerator. We got to make inflammation. Inflammation is not a bad thing, you guys. Inflammation signals to our body to actually say, there's a pathogen, go kill it. We want the inflammation. The bad part is when the accelerator goes so fast and the brake doesn't work. Because what happens normally in our system is that the brake will come on and it says, okay, I'm done with the inflammation. I'm done killing this bacteria. I'm going to put the brake on. What happens in coronavirus with this cytokine storm is that it accelerates. The virus chomps off that little ACE2. The virus chomps it off, and the ACE and the vitamin D is what causes the brake. The vitamin D is what helps the ACE2 push the brake. Get it? Mm-hmm. Vitamin D actually is a part of our innate immune system as well as our adaptive immune system, right, Dr. Alexia? The innate immune system is our first defense. You might not even know that you're sick because our innate immune system says, oh, this is not right. Let me go fix that. The adaptive immune system is the one that makes the antibodies. It's the one that comes after it. And vitamin D is in both sections. And so it is my plea to everybody to boost up your vitamin D. And I'm going to tell you that bare minimum, all adults need to be on 4,000 IUs of vitamin D right now. So the standard reference range when you're checking blood levels right now is like 30 is the low. That has never been my standard. My standard has always been 50 for a vitamin D level. And I'm so annoyed right now. I check labs every 3 months on my patients. I've done this for 15 years and I check vitamin D every single time. They are charging $362 now for people to check vitamin D because they know that this is important. The system sucks. I'm just saying, okay? So check the vitamin D levels. It is safe for you to do a loading dose. So 10,000 IUs is a safe dose every single day for a week to get your levels up. You really can't overdose on vitamin D. If you take 1 million IUs every day, yeah, you're going to overdose. But I've seen anywhere from 50 to 100,000 IUs daily. Okay. I wouldn't do that. I'm suggesting 4,000 IU daily for your adults, 1,000 to 2,000 for your kiddos. All right. So when it comes to Thanksgiving, let's talk about Thanksgiving. All right. So a couple of different things. One is holidays are stressful. Dr. Napoleon talked about it. Dr. Male Donald Brown talked about it. There are several things that we can do naturally to decrease the stress, right? So gone are the days when we think about mind, body, spirit is woo-woo. We know that the mind also contributes to our body. We know that stress depletes your immune system, right? Stress. And holidays are stressful. And I can't even tell you how stressful this holiday might be for some who can't be with their loved ones, who have lost their loved ones around this time last year, or who have loved ones in the hospital, or who have lost loved ones to coronavirus right now, right? Alternate nostril breathing, tapping, making sure you're hydrated, and sleeping. Right, Dr. Dawn? She talks about this all the time, sleeping, to decrease your stress, right? But then when we're also talking about those of you who are just adamant about, I'm going to go see my family, you're adamant about it. Can you please take the 6 vitamins that I just said? Take the 6 vitamins. I wish you had started 4 days ago and done 14 days worth of it, but you can start now. You got 10 days. You have 10 days to boost up your immune system, because if you're going to go visit your family, then at least you can protect yourself, build up your immune system, and ask your family to do the same. Those of you guys who are going to be together, at least you can build your immune system. Not only wash your hands, not only wear your mask, not only social distance, but build up your immune system, right? Build up your immune system. You can do it with your food too. So vitamin D specifically is in lots of different seafood. It's in your red meats, specifically liver organ meat. For those of you who are vegan and vegetarian, it's in papaya, it's in melon, it's in peaches, it's in your squash. So you can find the foods that boost your vitamin D up. Us as African Americans, we are at a higher risk for vitamin D deficiency specifically. And it's wintertime. It's wintertime. It's even worse. Okay. Yeah. So skip it. Don't think that you're going to go outside and get it right now, but take the supplement. I am a supplement formulator. It is okay to take supplements when you need to take supplements.
Yeah, that's a very good point, Dr. Sam. And it definitely relates to mental health. I know I order vitamin D all the time. I mean, yes. More than often than anyone else, and probably the same as frequent as you do. It helps with depression. There's been studies that show how vitamin D has been helpful with treating biological depression, also help with seasonal affective disorder, which you mentioned as well, bone density, immune, brain growth and development. So it is important because our brain is still growing, especially if we're in our early 20s, all the way up to 26, I believe has been the latest study. I'm not sure, but mid-20s, the brain usually stops growing. So don't believe it starts growing earlier on. So the vitamin D is very, very helpful, even in kids. And just make sure you consult with your pediatrician how much vitamin D they should get. And that's going to be helpful to their immune system. Dr. Sam, thank you so much for all of the important information. We really do appreciate you being here and sharing the information. Rita has a question for you. She asked about, what about echinacea? Do you know if that's helpful or not?
Yeah, so there's, so echinacea is fantastic for immune boosting, period. Echinacea is one of those things where you can take it for a period of time and then you need to stop because your body becomes resistant to it or it builds up. So you can take echinacea probably for 6 to 8 weeks is my recommendation. And then you need to take a week off and then you can restart it. But yeah, echinacea is fantastic. The 6 that I specifically was talking about is specifically research for coronavirus but echinacea, cold and flu season, absolutely.
Awesome. And I know that Dr. Zarina has a supplement line, so we're going to support her. We're going to make sure we have the website. Dr. Sam, I believe you have a supplement line. And then we're also about to go to Dr. Nicole, who also has a line as well. So Dr. Nicole, last but certainly not least, darling, listen, the person that is well aware and well knowledgeable about, especially about our veterans, we know that this time of year is particularly special for many of our families, our armed services. We just celebrated Veterans Day. Can you give us some information on how we should be how our veterans should be staying connected? Staying connected, if that's with their provider, with their family. Can you provide some recommendations on that, please?
Absolutely. So we know that with our veterans and our veterans health, there are currently, well, the last check was back in 2018, but we know that there are about 18 million veterans at the last check of 2018. There are 175 VA hospitals. All right. So 175 hospitals, 18 million patients, right? 18 million veterans. Now, we do know also that there's only about 7 million veterans currently enrolled in VA healthcare. So one of the first things I would tell folks, veterans in general, is if you are a veteran and you are service connected, which means that the VA has recognized that whatever health conditions that you might be dealing with is because of something that happened during active duty, you need to be going and getting some care at the VA. Now, I've heard a lot of veterans say, okay, well, I don't want to go to the VA because, again, there's 18 million veterans and only 175 VA hospitals. And so sometimes the wait times can be a little bit longer, or they feel like, I feel kind of rushed, or I feel like a number because I don't feel like I'm getting personalized care. However, please know that the care is there and it is available for you. Okay. And it can be top notch. Now, I've heard of some shady VA systems, and I know we've all heard about them in the news, but for the most part, VA systems are top notch. They have great providers and great specialists. And then if they can't provide it there are now things in place where they can go to community care clinics. So you can be sent to the community specialists or even some of the primary care clinics, community care, and your VA benefits will still take care of you. So my first recommendation for veterans, if you are a veteran, is to go and seek some care at a VA or find a community care clinic where you can get some care for all of your conditions, but especially your mental health and your physical health as well. Now the VA is using a messaging portal. There's something called My Health eVet, and all veterans, I encourage all veterans to sign up for My Health eVet. You have access to all of your records, and you have this great messaging portal to your doctors. So I know that most, I think one of the other doctors talking about, might have been Dr. Alexia, using the messaging portal with your doctor. Well, the VA has that as well, and a lot of veterans weren't aware of that. But you can send your doctor a message in My Health eVet through the messaging portal, and so you can reach out to your doctor, and you don't have to wait for a phone call or a phone call back. You send a message, and the nurse or the doctor even, or the provider, can send you a message back. The nice thing about those messages too is that it can become and goes into your medical records. So no longer are you relying on somebody to relay your message. If you call and give a long list of symptoms per se, and you're hopefully somebody will give that message as you gave it. Now you can send that message directly to your provider, and that message then becomes part of your medical records. So that's great for documentation, which you'll need if you're going to later on try and file a claim for that. And it's great for it to be able to speak with your doctor. So in general, not just on my veteran side, but even on my primary care side, I am encouraging all of my patients to use messaging portals, use online portals with your doctor, because that's a great way to reach out, A, for screenings, B, for some routine medical care that you might not have to come in. I know a lot of people, when COVID was first happening, were saying, well, the VA is closed. The VA never closes. Believe me, it never closes. What happened was they closed down the waiting room, and they didn't want you to come into the waiting room if you didn't have to. But the VA never closes, all right? So if you are having an emergency, if there's something wrong, it was open. And even for appointments, it was open. It wasn't, you couldn't just go and hang out in the VA like you used to, right? And as a social hour. So the VA never closes, but use that messaging portal. It's really important. Like I said, A, because you can communicate with your doctor, B, because it goes into your record as it goes part of your medical record, which is good for documentation.
Awesome. Dr. Nicole, how can veterans get tested for COVID-19 if they're interested in doing so? And if they're positive, how can they receive help?
Absolutely. So the veterans can go, to the emergency room and get screened. And the nice thing is, if it does come back positive, the VA has this excellent way of monitoring the COVID-19 positive outcomes. So I had a veteran a couple of months ago who was positive, and the next day he got his test back the next day, when lots of people were having to wait a long time, but he got his test back the next day and he was positive. The second he got that positive result, he also got a call back from a nurse, and they set up a monitoring system. And so that nurse called him 3 times a day. They also sent him out his own blood pressure cuff. They sent him out a thermometer, and they sent him out just some other equipment in general for monitoring. And so I recommend that everybody right now should have those things anyway. You should have a thermometer, you should have a blood pressure cuff, you should know how to take your pulse. But if you don't, because that's also, we need that for telemedicine. But the VA does provide those things to the patients when they become COVID-19 positive. And then, like I said, the VA nurses are checking with them to find out, are their symptoms changing? Are their symptoms improving? Are they asymptomatic in general? But it's a great monitoring system, because they are trying to, they're also setting veterans up with the vitamins that Dr. Sam was talking about, such as the vitamin D, the vitamin C, the zinc, the melatonin, which a lot of our veterans, we already see them on the melatonin anyway because of mental health conditions, problems with insomnia. And so, but all these things, of course, are being provided to our veterans when they're testing positive. So yeah, they're getting the blood pressure cuff, they're getting thermometer and a pulse ox. They're getting a pulse ox. So this is great for all patients to have, that you should have that anyway. But they do provide that for the veterans. And then they're in a, we all should be doing contact tracing, right? If you test positive, but the VA has a great way of helping provide you with some of that contact tracing so that you can kind of figure out where did you get it from, and then who are you around. And they're also helping test, families. And if your family is positive, they're providing some services for the families as well, based off of your level of service connection. So it's a great, I've heard a lot of negative things about, the VA system, but the VA has a great way of monitoring patients with COVID-19 positive. And so please, veterans, if you are concerned about, that you might have it or you might be symptomatic, those symptoms that Dr. Zarina was talking about that people say are not symptomatic, but if you are, please go and go to the VA, get tested, and get in. If you are positive, get into that tracking program, because it's really important, especially for our long-term health, since we are finding that there can be so many sequelae that come from being COVID-19 positive. And because a lot of our veterans already have underlying health conditions, you're at a higher risk for becoming COVID-19 positive. We also know, I think it was Dr. Brown that talked about this earlier, that when they're finding, there's some research, actually, I just read an article today that people that have an underlying mental health condition actually are at a higher risk of becoming COVID-19 positive. And we're seeing, of course, higher numbers of COVID-19 in people that have mental health conditions. And then we're seeing higher mental health conditions in people that are COVID-19 positive. So which comes first, the chicken or the egg? I don't know. But in general, we know that they're all related. So we need to find ways to monitor.
That's good lead into the last question I have for you, Dr. Nicole. In knowing the increased incidence of mental health concerns in general, especially around the holiday time, but especially for our veterans, whether they be at high risk for COVID, whether it be just because of the holiday season, they're physically distant or isolated from their families, they can't get to their families. How can they get service connected in order to receive effective mental health services, and making sure that, either they're service connected to the VA or they can file for claims? Is there any proper way that you would recommend they go by?
Absolutely. So service connection is based off of three main things. It's something that happened during active duty that can be documented. So it's in your active duty records. You have a current clinical diagnosis, and then you need a nexus statement, which is the link that explains how does one currently was caused by what happened in active duty. And so if you had something happen in active duty, first of all, I would hope that it was documented. But even if it wasn't, there are ways to figure out how to get things service connected. A lot of the problems with veterans is that they didn't go complain about things while they were in the service. And so getting service connection can be difficult now, but it's not impossible. I would say that the other thing that our veterans are, a lot of them are already service connected, especially some of them that were in combat zones and in combat areas. So they're already service connected, but where they kind of are falling short is that they're not continuing to complain about their symptoms, and they're not having their current symptoms documented. And so they might be at a lower claim than what they need to be actually getting compensated for. And so what I encourage all my veterans is, please make sure that you are going to see your doctor. And that doesn't have to be at the VA, although of course that care would be financially covered or free. But even if you're going outside of the VA system, if you're going to a civilian, if you're going to see, even to an urgent care or to a teledoc system, that make sure those records are being sent to the VA, so that if you are going to put in a claim later on, they have those records to show that you are currently being treated for something, and that shows your current level of severity. Again, like we said, we know that coronavirus in general is making lots of people have more mental health conditions, and it's becoming more apparent. But if you already started at a baseline of already having some mental health conditions, then coronavirus can be worsening things. And that's where I'm really encouraging my veterans. If you are worse, reach out and get some help. And then make sure that's being documented. And then later on, you can go back and you can file for an increased claim or even a new claim to see if that can be connected later on. We also know that because of that connection that we talked about between the mind, body, and spirit that Dr. Sam was talking about, when people have a physical condition, it can often spill into their mental health. And so even if you have let's say a heart condition that is service connected, and now you're dealing with some depression or some adjustment disorder, we know that you can get what's called a secondary service connection for that depression because of the heart condition that you're dealing with. And so there's a way that you can connect lots of different things, and you can reach out to, there's all kinds of, well, there's not a lot, but there are some experts out there who can understand VA disability claims and the correct way to kind of go about them. So you can always reach out to them. But the big key is documentation, and don't be afraid to reach out and get some help. And that's my biggest thing, especially in these times when we are dealing, like you said, Dr. Dawn, with more mental health because of the holidays and because of isolation and because we can't be around our families like we used to, or we're dealing with loss, or we're dealing with just more on us in general. So we're carrying a lot more stuff. So there's, increased in our mental health conditions. Go and get seen, get it documented, and then let's get our minds right.
Awesome. What a fabulous way to end this. Listen, thank you, ladies and gentlemen. Thank you, docs. I really do appreciate you coming on and just being here, being committed to making sure that our communities are well informed about the updates with COVID, in particular in relation to your specialties or your roles that you serve in. Thank you for being here. I really do appreciate you all. I definitely want to just go around one more time. If you all can just kind of mention where you can be found, and if there's any last minute, or not last minute, but final, comment that you would like to make, to reiterate the facts that you've stated, or any new information you wanted to share. And I'll start with Dr. Steve.
So thank you, Dr. Don. Thank you, everybody on this panel. It was a great panel, a lot of information, definitely food for the soul, pre-Thanksgiving meal. You can follow me on Twitter at Dr. Steve MD, on Instagram at Dr. S. Noble, and on LinkedIn. As we head towards deep into the pandemic, keep in mind that we're headed towards a shutdown, and we need a mandatory shutdown. So stay vigilant, prepare, and write your Congress people, write your senators. We need financial relief for people to stay at home. As we could near a Great Depression, and therefore we need financial relief. People need to stay home, and therefore they need income to do that. So I urge everyone to stay on top of it. For people out in Georgia, make sure you get out there and vote, because we still have a fight till into 2021. So thank you, everybody, for being here tonight.
Thank you, Dr.
Be safe,
Steve.
be well.
That's Zarina.
Yes, thank you again for having me. I want to echo that. Georgia, we have some work to do. So let's gear up and get ready for it. And again, you can reach me across all social media platforms at Dr. Zarina. That's DrZarinah. Across all social media platforms. Look for your Black Friday sales and everything else. Support Black businesses, Black doctors. And we are here to support you. So keep masking up and social distancing.
Awesome. And again, I know they're saying their websites, which I would like for them to continue to do so, and they will also be in the actual posts, so you can actually just click on their hyperlinks as well. Dr. 𝘄𝘄𝘄𝗃.
Yes. So my final comment is, we haven't said it tonight. If you have tested positive, stay at home, whether you are symptomatic or asymptomatic, and notify the people you've been in contact with. Like, let's not let people be out here and you've exposed someone and you do not have the decency, the human decency, to notify someone that you have tested positive when you were just at a gathering with them 2 or 3 days ago. So number one, whether you have symptoms or not, quarantine until you are released from your physician. And number two, notify your recent contacts that you have tested positive. And I am Dr. 𝘄𝘄𝘄𝗃, your board certified OBGYN. You can find me on all social media platforms at Dr. 𝘄𝘄𝘄𝗃, OBGYN.
Thanks, Dr. 𝘄𝘄𝘄𝘃. Appreciate that. Dr. Brown.
All right. Thanks, sis, for having me on this esteemed panel, and thank you all for the message that you shared tonight. You can find me on Instagram at DBDeuce, so DEEBEE_Deuce. You can also find my community service organization out here in Los Angeles on Instagram at 𝘄𝘄𝘄𝗃 Project. That's UJIMA, Swahili for Collective Work and Responsibility Project. And you can also find me on the Daddy Issues podcast, again on YouTube with Tony Baker and 𝘄𝘄𝘄𝗃 discussing mental health issues, especially amongst Black men in our society. Just thank you all, and just make sure to take care of your mental health.
Awesome.
It's just as important.
Dr. Alexia.
All right. So thank you for having me on. You guys have made such wonderful points tonight. You can reach me at Dr. Alexia. That's DRALEXEA. Again, that's at Dr. Alexia, DRALEXEA on Facebook, Instagram, and Twitter. You can also connect with me via my website. It's www.dralexia.com. Again, DRALEXEA.com. And I so look forward to connecting with you all. Just again, continue to be vigilant, wear those masks if you leave your home, but ultimately we all need to stay home as much as we can. Wash your hands, avoid those top 4 places, no restaurants, no bars, no gyms, and social distancing or avoiding houses of worship right now. And again, please just be considerate of taking a COVID-19 vaccine if and when they are available to you.
Alexia, thank you. Dr. Jarrett.
All right, I'm Dr. Jarrett. You can follow me on all social media platforms at Dr. Jarrett_DDS, DRJARRETT_DDS. Follow my hair care line at Honey Envy on social media at Honey_Envy. Black Friday is coming up. You want to get on that mailing list. HoneyEnvy.com is the way to get on the email list. And I will definitely piggyback on what some of the other docs have said. Georgia, we are not done. We're still in this thing. We got work to do. You still got time to get out there and register to vote. Let's make it really, really happen, because this is what counts. Senate seats are what counts for us. So definitely get off your behinds, get out there and vote, make it happen. Let's turn it all the way blue. Let's turn this state all the way blue. It's proof that we have done it. It can be done. Let's keep it moving. Let's keep it pushing. And lastly, it is not too late to change these Thanksgiving plans that y'all already had, okay? It is not too late to change in-person Thanksgiving plans, because there's no way you guys should continue to be in person for any holiday. In-person Thanksgiving should be canceled. Let's be creative. Let's find other ways to get it done and still celebrate friends and family. Furthermore, listen, we have bet and gambled with this virus, and we have lost for so many months. If we continue along the same path, we will continue to lose. So how many lives do you want to continue to bet against? It's not going to happen. Just stay home. Stay home. Wear your mask. It's about to be a bumpy ride. If y'all thought it was bumpy, these last few months, it's really about to get bumpy. So just buckle down, stay home, think about others, and protect others. That's really all I have to say. Let's think differently about this virus, because clearly we haven't done so.
No, thank you, Dr. J.
Thanks,
Appreciate
Dr.
those
Dawn.
comments. Dr. Napoleon.
Well, Dr. Dunn, I want to thank you once again for putting this together. You can find me at NapoleonHigginsMD.com. All social media is at Napoleon Higgins, NapoleonHiggins. Only thing I can say is duck down and stay low, because Rona out here creeping, and it will get in your bed and attack you like a thief in the night who be like touching on, so I'm just saying, Rona out here, stop lying to yourselves. All right, stop lying to yourselves. We lie to ourselves about a lot of things. Make sure you take care of your mental health. That can be attacked as well with this virus. Love y'all. Thank you.
Love you, Dr. Napoleon. Appreciate you, brother. Dr. Sam.
Hey, y'all. So I realize that COVID fatigue is real. I have it. I'm over it. Okay. But if you haven't heard it, let me tell you now that this is a marathon and not a sprint. Okay. And if you know the parable, the little the turtle won the race and not the hare. We need to be in this for the long haul. I know we're all tired, but you have to be diligent. You have to be diligent with everything that we just said. And if there's one thing you can do, you can share this video with your loved ones. You know what I mean? You guys have your Zoom calls with your family members. You know, have a Zoom call with your family members and show this video. You have 10 amazing doctors. I learned stuff today, okay? So, and I'm a doctor. So I know your family members can learn something if I learn something. So share this video with at least one of your family members so that you guys are getting all on the same page. Protect yourselves. Protect yourselves. And if you don't want to protect yourself, do it for your loved ones. Do it for somebody else. How about we just not be selfish anymore? Put your mask on. Wash your hands. Social distance and stay at home. Okay, that's really what you need to do. If you just are adamant about going to Thanksgiving, please boost up your immune system. Please wash your hands, social distance, wear your mask, take the 6 supplements that I suggested. I'm Dr. Sam Price. I'm a board certified and licensed naturopathic physician. That means I'm an expert in natural medicine. And you can follow me on all social media at Dr. Sam ND. That's DrSammND. And my website is the same thing, drsamnd.com. I have an 8-page article right now on how to boost your immune system naturally.
Awesome. Thank you, Dr. Sam. Appreciate you. Dr. Nicole.
All right. Well, Dr. Dawn, I appreciate you bringing me on one more time. And I thoroughly enjoyed all the information that I've gotten from all the docs tonight. I can be followed on all social media platforms at Dr. Nicole D.O. That's DrNicoleDO. And if I had one final thought that I wanted to leave with folks when it comes to coronavirus, it is that coronavirus is like playing a game of Russian roulette. Okay. And I've been saying this since day one. You might have it and you might not have any symptoms at all. Okay. And so you dodged a bullet. However, as you pass that bullet on, that loaded weapon on to the next person, they might not dodge the bullet. Okay. And so it's very important that we don't play around with this coronavirus. All right. And going to holiday gatherings at this point is like playing Russian roulette with a loaded weapon. So we don't want to do that, right? Coronavirus kills. It does, just like a loaded weapon. And so y'all, please don't take that risk. Please don't take that risk around your families. And it's not just now the elderly or people with the pre-existing conditions, it's anyone. This is not something that we want to play around with, because even folks who are young or folks that don't have pre-existing conditions, they get these sequelae that afterwards that it can screw things up. You know, we're seeing the football players with the long-term now cardiac conditions, and it's just not something that we want to play around with. And again, if you are having symptoms, please go to an ER, go to a doctor. Don't be afraid to go in someplace and get seen, even if that means sending your doctor a message and saying, should I be going and getting seen? And, you know, that doctor will respond, yeah, take your tail on over to the ER and get a swab, right? Please, because this is not something that we want to play around with. And again, for my veterans, if you are having any problems that are related to coronavirus or to your mental health or even your physical health conditions that have worsened because of COVID-19 or because of everything that's going on, please get it documented and please reach out even to me for some assistance with how do you file claims and how do you connect this to your service-connected conditions. It's really important that you're going to see your doctor getting things documented. Again, Dr. Nicole D.O., and you can get to my other websites from that site, but DrNicoleDO. And I am offering all veterans a 15% discount on all of my supplements right now until the end of the year. That was a Veterans Day gift we did from last week, but I'm extending it to the end of the year. 15%, coupon code is VET on my website. So Dr. Nicole D.O. /shop, and you can get all my supplements. Thanks again for having me, Dr. Dawn. Appreciate it.
Thank you. Thank you, everyone, for being on here. Thank you for your time. Thank your families for me, please, on my behalf. You have received a wealth of information tonight from wonderful doctors who are just going to give it and keep it real to you. And they actually shared a wealth of information that should be shared with other people that you love and know. So make sure you share this. Make sure you wash your hands. Make sure you stay masked up. Be vigilant. Stay that physical distance, and find creative ways to celebrate the holidays. We want to make sure that you look at this long term, all right? This is a long-term thing. Like Dr. Sam said and someone else said, this is definitely not a sprint, it is a marathon. So look at this long term. And when you start to look at things long term, hopefully other people will be involved in that vision. So not only protecting yourself, but protecting those that you love, and making sure that this is just a snapshot of our long-term vision, right? So we can definitely work through this. We can get through this so that everyone can actually collectively be together without masks one day soon. So if we stay together, stick it through, we will get there. Again, thank you everybody for being on. I really love and appreciate all of you, and we'll see you next time on Live with Dr. Dawn. Have a good evening. Bye-bye.
I got no rules, I count 'em.